नमस्ते बिटिया हमेशा खुश रहो बिटिया I am Dr. Bharat Sharma, Assistant Professor, Department of Pathology, Faculty of Homeopathic Sciences, Jyoti Vidyapeeth, Women's University, Jaipur. Today we are going to discuss about intestinal tumors. Although small intestine is about 6 meters long, but for obscure reasons, benign as well as malignant tumors in it are surprisingly very rare. Most common benign tumors in descending order of frequencies are: first is gastrointestinal stromal tumors, also known as GIST. Second is leiomyomas. Third is adenomas. And fourth is vascular tumors, which is hemangiomas and lymphangiomas. These all are benign tumor of intestines. Now we are going to learn about malignant tumors of which are most frequently encountered in intestines. First is carcinoid tumors. Second is lymphomas, and third is adenocarcinomas. All these tumors are identical in morphology to those seen elsewhere in the alimentary tract. Now we are going to learn about carcinoid tumor. It is also a malignant tumor, also known as argentaphenomas. It is a generic term applied to tumors originating from endocrine cells. The endocrine cells are distributed throughout the mucosa of gastrointestinal tract. These cells have second secretory granules which stain positively with silver salts, also known as these secretory granules, also known as argentafin granules, or many stains after addition of exogenous reducing agents, non-argentafin or argyrophil granules. Depending upon the embryological derivation of the tissue where the tumor is located, these are classified as foregut, midgut, and hindgut carcinoids. First, we are going to learn about midgut carcinoids. These are seen in terminal ileum and appendix are the most common, almost 60 to 80% of cases, and are more often in argentafin positive. Now, hindgut carcinoid tumors. These occurring in rectum and colon are more commonly argyrophil type and comprise about 10 to 20% of carcinoids. Now, third is foregut carcinoids tumor. These located in the stomach, duodenum, and esophagus are also argyrophil type and are encountered as frequently as in the hindgut, 10 to 20%. Appendical carcinoids occur more frequently in third and fourth decade of life without any sex predilection, are often solitary and behaves as locally malignant tumors. Ileal carcinoids, on the other hand, are seen more often in later ages, about 7th decade, with female preponderance are more commonly multiple and behave like metastatic carcinomas. Morphological features of intestinal tumors. All carcinoid are small button-like submucosal elevations with intact or ulcerated overlying mucosa. They are usually small. Those larger than 2 centimeters are more often metastasizing. Ileal and gastric carcinoids are commonly multiple, whereas appendical carcinoids commonly involve the tip of the organ and are solitary. Histologically, the tumor cells may be arranged in a variety of patterns, either in solid nests or as like sheets, cords, tubercle, and clusters, all of which show characteristic palisading of the peripheral cells. Lymphomas. Malignant lymphoma of the small intestine has a few peculiarities. First is presence and type of an underlying disorder. For example, long-term malabsorption syndrome, acquired immunodeficiency syndrome, Crohn's disease. Second is primarily versus secondary lymphoma. Extra Extranodal lymphomas is more common in gastrointestinal tract than anywhere elsewhere. It is important to rule out spread of primary nodal lymphoma to the intestine. Now for summarize the intestinal tumor, gliomas and gastrointestinal are example of benign tumors of small intestine. Carcinoid tumors originates from endocrine cells and it may occur in midgut, hindgut and foregut. For the microscopical examination or as we seen in morphological features of these carcinoid tumors are they seen grossly in small button like nodule over mucosa and microscopically seen the tumor cells are monomorphic and have typical endocrine patterns. Non-Hodgkin's lymphoma of B-cell type is another common malignant tumor in small intestine. This session is powered by digital version 2.0 Jyoti Vidyapeeth Women's University. I hope you all enjoy this session. If you have any query, please mention in the comment box. Thank you.